everybody, and welcome back to the Medical Minute. I am Jill Hunt, and with me today is our medical director and my counterpart, Dr. Philip Leming. Today is May 5th, and most of you would know it as Cinco de Mayo, and I'm sure we'll probably be enjoying at least one margarita. However, it is also Melanoma Monday, and so we are going to talk about melanoma. We're going to talk a little bit about moles and their association with melanoma.
So you're going to talk about the mole patrol?
The mole patrol.
The mole patrol.
Yes.
That sounds like a good topic.
Yes.
Yeah. So what would you want to know about moles if you were out there asking these questions?
If I have them, should I be scared?
No. Moles are, for the most part, normal. But in general, a mole is, people recognize is a dark pigmented area on the skin. And most everybody has them. Interestingly, children, it's somewhere between 1 to 6 moles, and usually on the legs. And the peak number of moles that people get are in their 20s and 30s. And as we get older, they get less.
So if you notice a skin change or something, like a mole that would pop up as you're older, would that be more concerning?
Well, it's also the things that affects the number of moles are hereditary factors. Sun exposure is a dominant thing, particularly sunburn damage before the age of 20. Also, what's interesting is since the higher the risk of sunburn damage before the age of 20 is associated with a higher incidence of melanoma, but also if you have greater than 20 moles, that puts you at a higher risk. So it's like a 20-20 rule here.
So, unfortunately, we're at our highest risk for causing the damage that can cause melanoma when we're the least concerned about it.
Correct.
Good.
Yeah, it's sort of like when we're the dumbest as young people. Yes.
Yeah, got it.
And who are the dumbest of the dumb that get the highest rising incidence of melanomas?
Men
over 50 and on the trunk. We didn't pay much attention to that when we were young.
No. And I mean, even when, I'm a little younger than you. And
not much.
Thank you. But even when I was young, it was when tanning beds were, starting to be very popular. Nobody was using sunscreen. I had just come off of the generation of using baby oil and iodine to get that really good tan. So
that just parallels it, excessive ultraviolet damage, whether it's sun or tanning beds, increases your melanoma risk, plus it also will increase the number of your moles. The other thing to understand, a mole is a little dark spot. You're mostly, when you're monitoring for this, it's the A, B, C, D, E of melanoma. Do you want to tell people what that is?
No.
You don't? So the
abnormal,
asymmetric
borders. What does the borders look like? Are they staying the same? Are they changing?
And C is the color. If you get different colors in a mole, that's something to pay attention to.
D.
And the size, they always comment on the size of an eraser top at 6 millimeters, but basically larger moles are more concerned than small ones.
So here's the question, though. If you have a larger mole, and let's say it's been there since you were a kid, is that still high risk if you go a long time and that mole has never changed? Well,
you've got two groups of moles. Ones that are acquired and others that you're born with are congenital moles. Congenital moles tend to be a little higher risk for developing melanoma over your lifetime. And again, these are things that you're born with, not something that you acquire with time.
So as an adult, if you have a mole or moles, when do you get concerned? When do you say, I should probably have that looked at?
Well, anything is changing. Also keeping in mind that not all melanomas, for instance, not all have pigment. the general rule, if you got something that's pink and changing, you need to biopsy it because you cannot tell by looking.
Do all melanomas come from moles?
All melanomas come from a cell called the melanocyte. Moles are basically what are called monoclonal populations of melanocytes. In other words, if you look at one mole, all those melanocytes in that pigmented area are just identical copies of each other. If interesting, also moles have some of the same mutations that melanoma has. They have a high incidence of BRAF mutations and NRAS mutations, but that doesn't necessarily mean that they're malignant.
What is the difference between a freckle and a mole?
A freckle is more of a splotchy skin appearance of pigment that's in the higher upper part of the skin rather than down in the dermis.
Can you get melanoma in a freckle or from a freckle?
It depends on what you describe as a freckle. There is a form of melanoma that occurs on the face that looks almost like that you cannot tell the difference.
So then what is the best thing for people to do if they have lots of freckles or lots of moles?
It's kind of like, Homeland Security. You know, it's see something, say something.
True statement.
So.
Well, and really, in all honesty, if you have a high-risk skin surface, if you have more than 20 moles on your skin surface, if you are a super freckly person, if you're pale and fair skin, light hair, light-eyed, anything that puts you in that kind of higher risk, you should be seeing dermatology every year.
And I always try to point out that if you have a mole that's changing, or you go to your family doc and they're concerned about something, request your family physician to call and make your appointment with the dermatologist. Do not just go try to make your appointment because there's such a long time getting in.
It'll be 6 to 9 months before you get in.
Yeah.
The other piece, too, is with seeing the dermatologist. You know, when we think about cancer screening, if you think about it, you know, they talk about your first mammogram after 40. They've changed your colonoscopy to now 45. So does that mean that I don't need to start seeing a dermatologist until I'm in my 40s?
No, it's a bit complex. It depends on your skin pigmentation. The greater the pigmentation that you have in your skin, the lesser the incidence of sunburn damage. The pigment, the melanins, of which melanocytes make, account for all the color of pigment of humans and the hair colors of animals and the feather colors of birds. So the more intense of that preventative pigment in your skin, the lesser incidence of damage to the skin. For instance, Scandinavian people have a much higher risk of sunburn damage than African darker pigment, and you have the population of the world in between all that. So it's an individual thing.
So if you have a child who has been born with more than that kind of 6 threshold moles, should they be seen by a dermatologist earlier on?
Depends on the where you live and the type of sun exposure, but the answer would be if you got a lot of moles as a child, yes. If you have a family history of melanoma or a lot of moles, the answer is yes. Again, it's an individual decision.
And usually if you are seen by the dermatologist, if you have any concern and you just make that initial visit, the dermatologist will guide your follow-up from there. If you take your child, they'll let you know, no, you don't need to be coming every year. We'll see you back in 2 or 3. If you take your teenager, probably by the time that they're a teenager, if there's any concern with their skin being at higher risk, they will be starting to see dermatology on a yearly basis.
Also the comment would be is going to a dermatologist is only part of the picture. This is a team project.
Yeah.
It's a team project of the person and their family because you see the skin a lot more intensely than the dermatologist in a short visit. So intuitive concerns about a spot on the skin or a change needs to be brought to the attention of the dermatologist, because most of the biopsies that are done, the dermatologist knows that they need to be biopsied, but they don't know what they are. And there is a significant intuitive sense, particularly among women watching over children or women watching over their significant others, that also ends up resulting in a diagnosis that otherwise wouldn't happen.
I don't know how many times we have said when our male patients have come in and we're asking them about their story and how they were diagnosed and when the biopsy was completed. And as you're listening to the story, Dr. Leming inevitably pauses and says, "What woman made you go and see the doctor?" So it definitely is a team effort. It's important to be aware of your skin surface, know if anything changes. That way you can alert your medical professionals and they can get you to where you need to get.
And if you wanted to pick one group of individuals that you can save a lot by simply looking at, and that is men over 50 on the trunk, is the highest rising incidence of melanoma in the United States. So a careful exam of the front and back of the trunk in men over 50 can save a lot of lives.
Absolutely. All right. Well, that is a wrap on our Melanoma Monday. Hope you have learned something today, and we will see you next time.
Enjoy the mole patrol.